Ontario Medical Association President Dr. Rose Zacharias joins us tonight. Dr. Zacharias, federal and provincial leaders are urging masking indoors again, but stopping short of actually mandating it. What do you think needs to happen here?
So I think we need to continue closely monitoring the situation, and our public health experts are doing exactly that. Ontario's doctors have always been clear it's recommended to wear a mask in crowded places, when gathering with vulnerable people, and yet this is an opportunity for some compassion and kindness. There are people who will make different choices, and so we know that masks are safe and effective ways of decreasing the transmission of the virus, and so it makes a lot of sense. We are needing to be ready to pivot if a mask mandate becomes in place.
And this is more than COVID now. How are hospitals handling RSV and influenza cases? What is the reality of the situation in Ontario?
Our emergency departments are overwhelmed, and here we are heading into the winter months. Viruses are more easily transmitted, and we know kids are getting sick with RSV, which is a common cold virus in kids. The COVID-19 is still circulating in our communities, of course. And then influenza season, we know, is going to be a severe one. It's here early. We're dealing with even 1,500 cases reported this time. Last year, there was only 7 cases of influenza reported. And so our emergency departments are under incredible strain. Our healthcare teams are doing their very best to provide good care, but are experiencing doctor and nursing shortages, are burnt out. Everyone wants to care for families and kids coming to the emergency department this time of year, but our healthcare system has some gaps.
And back to masking, for those who are against bringing back the mask mandates, what would you say to them? In what ways would this actually help?
So masks are safe and effective, proven to decrease the transmission of the virus, especially if you're within 6 feet of someone in a crowded place with vulnerable people, elderly, those with multiple medical conditions. And so we need to be mindful of our neighbors and community members to be wearing masks in those places, public transit, for example. And we need to be ready. If indeed public health deems mask mandates important and necessary, we may need to shift and be amplifying that message as well.
When would you expect to see the province actually bring back mask mandates? Is there a specific time that would be necessary?
So we will continue to lean into the expertise of our public health officials who are monitoring the situation. We are also monitoring the situation. Of course, we want our communities, our families, our kids, all of us to be safe heading into winter when viruses are more easily transmissible and in this time of incredible healthcare strain. And so we need to be watching and waiting and ready to respond.
Dr. Zacharias, thank you for speaking with us tonight on Trending Now.
Absolutely.